If you chest bind, this video is for you. I'm going to talk about tips for safe chest binding, plus exercises you can do before and after you bind. I'm Alex Hill, and I'm a board-certified physical therapist with additional specialization in gender-affirming care. Chest binding can be a very affirming practice for transgender and non-binary folks, and it can improve mental and emotional health. However, 97% of people who bind their chest experience at least one negative physical symptom from binding. Chest binding involves compressing breast tissue to give the appearance of a flat chest. There are many ways that people bind their chest, including commercial binders, elastic bandages, sports bras, special tapes like trans tape, or layering bras or shirts. Chest binding can affect the skin, muscles, movement, and breathing patterns, especially with binding over long periods. Chest, back, shoulder, and abdominal pain are common side effects experienced with chest binding, as well as postural changes, muscle wasting, or rib fractures. Here are some safe tips for binding. Number 1, don't bind with plastic wrap, duct tape, or bandages. These are more likely to cause negative symptoms. Number 2, limit the hours that you bind. Don't bind for more than 8 hours. Take breaks during the day if you can, and don't wear your binder while you sleep if it's safe for you to do so. Number 3, avoid binding while working out. When you exercise, you should be able to breathe and move unrestricted. If you're using a type of binding material that is trapping heat and sweat, this can also increase the risk of infection and skin irritation. Number 4, listen to your body. If you have pain or difficulty breathing, remove your binder. Work with a physical therapist who has additional training in working with transgender and non-binary folks to get an exercise program that will address any pain or persistent symptoms that you might be experiencing with binding. So now let's talk about how physical therapy can help you. Physical therapists can address physical symptoms that you might be experiencing with binding. At your first visit, you'll be asked lots of questions like how often and how long you bind, what you use to bind, what physical activity that you participate in, if you're planning on or currently doing other gender-affirming care like hormone therapy or surgery, what your symptoms are, and what your goals are. The physical exam will involve assessing your posture, your gait or how you walk, breathing mechanics, your spine, shoulder and rib mobility, strength, and skin and tissue health. Based on the examination findings, your PT will provide you with an individualized exercise program to address your specific symptoms and optimize your physical functioning. I guess you want to know what exercises you should be doing. All right, here we go. Since the ribs, spine, and trunk are restricted during binding, it's important to open up and increase the mobility in these areas. For the exercises I'm going to show you, all you need is a doorway and something comfortable to lie on the floor, like a yoga mat. Before we start with the exercises, remember to always check with your healthcare provider first before starting any new exercises. And during the exercises, stop if you have any pain, shortness of breath, or other unusual symptoms. For the first exercise, all you need is a doorway. You're going to stand with your arms out to the sides, your elbows about shoulder height. You're going to place your forearms directly against the door frame, have one foot in front of the other, and gently come forward until you feel a stretch. Hold that for up to a minute. Next is diaphragmatic breathing. You're going to place one hand on your chest and one on your abdomen. Breathe in through the nose, really expanding and filling your chest and your abdomen. Pause, and then breathe out through the mouth. The key with this exercise is to really take that deep breath in and expand your chest and your abdomen and breathe out. You can also place your hands on the outside of your ribs and give yourself a little bit of pressure to really feel that you're breathing outwards. This can help because of the binding that restricts the ribs. Next, you're going to lie on your side, one hand on top of the other with your arms straight. You're then going to open up your arm, keeping it straight all the way to the other side so that your trunk and chest rotate. As you do this movement, you can also coordinate it with your breath. So you'll breathe out as you open up, get all of that air out, and then breathe in on the way back over when your hands touch. This is a really great mobility exercise for your chest. You can do it in sets of 10. Finally, our last exercise is called a windmill. You're going to stay on your side. Arms are going to stay straight and touching to start with. And then you're going to bring your arm all the way up overhead, over and down. So you're making a circle with that top arm. You can again coordinate with your breath, so breathe out as you're doing that opening movement. And you can also do this exercise in sets of 10. I hope this information and these exercises were helpful for you. Make sure that you subscribe to my channel and turn on those notifications.